Hello, everyone, and welcome to the latest edition of ECD Live. It is now my pleasure to turn the floor over to Katie Ham, who is the Deputy Assistant Secretary for Early Childhood in the Office of Early Childhood Development. Katie, the floor is yours.
Thank you so much and welcome everyone. Thank you for being with us today. As a reminder, this is our monthly ECD Live webinar hosted by the Office of Early Childhood Development in collaboration with partners in the Office of Child Care and the Office of Head Start. Our purpose in these monthly webinars is to share information about the administration's priorities for the American Rescue Plan, Building Back Better, hear voices from the field, and share information that can help us as an early childhood community as we address the pandemic and recovery. The focus of today's ECD Live webinar will be efforts to support and stabilize the early childhood workforce, address some of the current workforce shortages. We know our early childhood providers are the backbone of our early childhood system. And so we want to talk more about how we can support them. We also, within the last week, we now have vaccines available to children ages 5 to 11. So we'll be talking more about that and how the early childhood community can support getting vaccines to those children. I want to start by sharing a little bit of information about where we are today in terms of our early childhood workforce. As you all know, this sector took a tremendous hit at the beginning of the pandemic. We've made significant recovery since that initial shock, but we are still only about 90% of the way there in terms of recovering to the pre-pandemic levels, meaning we are operating without 1 in 10 of our early educators, and that has a significant impact on children and on families. This slide shows that childcare is lagging behind women's employment overall, and we know that people are feeling the effects of this workforce shortage all across the country. We know that providers report having difficulty hiring staff, and families are facing fewer childcare options. We know, though, that we have resources out there that can support grantees, can support states, tribes, and territories in addressing this workforce shortage. That's why we released a Dear Colleague letter on October 13th, urging states and local programs to invest their American Rescue Plan funds and their preschool development grant funds, if available, and other COVID-19 relief dollars to address the current early childhood workforce shortages. In this letter, we not only highlight some promising strategies that states, communities, and local programs can use to support the early childhood workforce, we also provide examples of state and local program investments and innovations in this area so that you can learn from other states and other communities that have done this. We will share in the chat the Dear Colleague letter and the appendix with state and local examples, as well as some federal resources and tools that can support your work on this issue. We hope you find these useful, and please definitely be in touch if there's anything that we can do to support you in learning more about these strategies. Some of the strategies that are highlighted in the Dear Colleague letter shown here include improving child care subsidy payment rates. That is something that many states are doing to address the workforce shortage and make sure providers have those resources to pay their staff more. Increasing staff wages, whether that's a wage increase or providing one-time bonuses and incentives. Providing benefits such as paid leave and health insurance, which we'll talk about a little bit later with some federal options to do that. Providing childcare retirement benefits. Funding scholarships and time off for training or enrollment in educational coursework, apprenticeships, other practice-based learning that can lead to a credential or a degree can be a way to both retain and recruit effective early educators. Expanding shared service models so that providers have some of the business support that they need, especially for family childcare, and investing in family childcare networks, in substitute pools so that when folks are out, there are ways to bring in substitutes and it doesn't further exacerbate the stress on the existing staff. And last but not least, providing staff wellness support, such as guaranteed breaks during the workday, access to adult-sized furniture in the classrooms, mentoring, coaching, mental health consultation for staff. All of these things can really improve the job quality and help with recruitment and retention. We'll share more about some of the state and local program examples later in the agenda, but definitely check out that resource, click on the link, and look through some of those examples. On today's ECD Live, in addition to sharing some new information about children's vaccines, we will be spending some time focused on health coverage for the early childhood workforce. We know that many early childhood workers have been undercompensated, and this includes benefits, which are a key component of a compensation package. In fact, survey research shows that early childhood workers are 2 to 4 times less likely to have health insurance or receive employer-sponsored health coverage as compared to K-12 teachers. Preschool and kindergarten teachers account for over 22% of all uninsured teachers, and teaching assistants have the second highest uninsurance rate among educators at 7.3% who are uninsured. This is especially important during the pandemic because early educators are on the front line. I've heard quite a bit during the pandemic from providers who have struggled to pay for health insurance and worry about the impact on themselves or their family. So this is why we are partnering with CMS, the Centers for Medicare and Medicaid Services, next week for a week of action focused on improving health insurance coverage rates for the early childhood workforce. We hope you will join us as champions of coverage and help build awareness among early childhood workers about more affordable health coverage available on the marketplace because of some of the American Rescue Plan Act investments in these subsidies that make it more affordable to purchase health insurance in these marketplaces. So we will hear a little bit more about that later, but wanted to preview some of the exciting things that we have coming up. And at this time, I want to turn to talking more about vaccines, and thrilled to have a message to share with you from Dr. Vivek Murthy, who is the Surgeon General of the US. Dr. Murthy was confirmed by the Senate in March of 2021 to serve as the 21st Surgeon General of the US. As the nation's doctor, the Surgeon General's mission is to build trust by relying on the best scientific information available, providing clear and consistent guidance and resources for the public, and ensuring that we reach our most vulnerable communities. Dr. Murthy commands a uniformed service of 6,000 dedicated public health officers who serve the most underserved and vulnerable populations domestically and abroad. As America's doctor, he helped lead the national response to a range of health challenges. A renowned physician, research scientist, entrepreneur, and author, Dr. Murthy is among the most trusted voices in America on matters of public health. In this video, we will show Dr. Murthy will talk about the importance of children's vaccines and the effort underway. We were hoping to have him here live with us today, and although he had another obligation and couldn't be with us, we're grateful for the video that he recorded to share with this group.
Hi, everyone. Thank you so much for having me today. It's really an honor to be here, and I'm so grateful for all that you have done to support families and children during this difficult pandemic. In our collective effort to protect kids and families, the arrival of the COVID-19 vaccines for children has been a landmark moment. I want to talk a bit about our outreach to parents about vaccines for children. We've had a vaccine for adolescents, 12 and up, for a few months now, but just recently, the FDA authorized the Pfizer COVID-19 vaccine for kids 5 through 11, and this has been supported with a strong CDC recommendation. Now, we want to make sure that every parent and every caregiver out there has the opportunity to get their questions answered, and that's why we're driving a variety of outreach efforts. This outreach is more important than ever because there is a wave of misinformation about COVID-19 and the vaccines that's already hit parents. Many parents have seen inaccurate and frightening claims on social media, in text threads, and in their inboxes. Now, I believe every parent has a right to the facts so that they can make the decisions for their children based on accurate scientific information. And misinformation robs them of this freedom. That's why we're asking parents to seek answers from credible sources like their doctor, their local hospital, their local health department, or the CDC. And it's why it's so important that we meet parents and caregivers where they are with scientific information from sources they can trust. To do this, we've been working with educators in schools, with clinicians in health centers, and with faith leaders in their congregations, along with other trusted organizations that have long-standing relationships with parents, including the National Parent-Teacher Association and the American Academy of Pediatrics. Now, we'll be providing all of these organizations with toolkits, fact sheets, and flyers with information about the vaccine, and we are setting up forums and town halls to answer parents' questions, including a town hall this past Sunday with dozens of faith communities. We're also working with medical groups to encourage doctors to talk to their patients about the vaccine and to appear on local media outlets. This will include appearances by Spanish-speaking doctors on Spanish language media so that all parents can get their questions answered, regardless of background or English language skills. In addition to all of this, we are going to be leveraging the full network of federal government programs and partners to get the word out to parents. And finally, we are setting up a nationwide network of vaccination clinics at schools and local health departments so that families have easy access to vaccinations in their neighborhoods, administered by organizations that they trust. And as part of this effort, we partnered with the Children's Hospital Association to host clinics at children's hospitals across the country. In all of this outreach, what we want to convey to parents is that this vaccine will help protect our children and our families from COVID-19. Now, it's true that overall, our children do much better than older adults when it comes to the worst outcomes from COVID. But with that said, COVID is far from harmless in children. During this pandemic, we've lost hundreds of children to COVID-19, including nearly 100 children in the age group 5 through 11. Thousands of our children have been hospitalized, and thousands have developed a serious COVID-19 related inflammatory condition that affects multiple organ systems, including the heart. On top of this, many kids have suffered with long COVID, where symptoms like shortness of breath, fatigue, and brain fog stretch out for weeks or even months. There are also the effects of COVID-19 on our kids' mental health and their social and emotional well-being, which all of you have seen firsthand. Many kids have struggled with anxiety, depression, and loneliness because of the pandemic. They've experienced disruption in school, in youth sports, and in their ability to see grandparents or gather with friends for birthday parties or slumber parties. The bottom line is that COVID-19 still poses a threat to the physical and mental health of our children, especially our most vulnerable children. This pediatric vaccine, which is now available to kids 5 through 11, will enable us to protect them and allow them to return to lives where they can learn, play, and thrive. As a father of a 5-year-old boy, I'm excited for this moment and eager to get him vaccinated. I also have a 3.5-year-old daughter. And I know for parents out there who have kids under 5, they're too waiting for a moment where they can vaccinate their child. My hope is that that moment will be coming soon. We anticipate that in early 2022, there may be a vaccine for children under 5. Now, finally, I just want to thank all of you for being a lifeline for millions of children and their families throughout this pandemic. One of my hopes is that this pandemic will represent a moment where we finally reevaluate our society's relationship to caregiving. Your teams, the childcare workers you partner with, and the families you support are doing the essential and deeply meaningful work of caring for the next generation. Your service has empowered children in every aspect of life, from the food they eat, to the medical care they receive, to the schools they attend. So from the bottom of my heart, thank you for supporting our nation's children through what may be the worst health crisis of our lifetimes. I am so grateful for you.
We'd like to definitely thank the Surgeon General for taking the time to record that video. Would echo his thanks to all of you for all the work you've done in spreading the word on vaccines, supporting parents and families. As a parent, I have a newly vaccinated 6-year-old. That's my little boy in my background right behind me. He got his first dose yesterday. I cannot tell you how relieved I was after 20 months of worrying, and share Dr. Murthy's hope that in early 2022, I will be able to get my almost 2-year-old daughter vaccinated. So really appreciate everyone's work, and we'll talk more about vaccines for children and adults later in our program, but hoping that all of you will partner with us in getting the word out to families. We have several speakers here with us today. Beth Link is the Director of Communications for the Centers for Medicare and Medicaid Services. She will talk about the week of action for our early childhood workers that kicks off next week, which will help this critical workforce access health coverage. Then we will hear from Dr. Bernadine Futrell from the Office of Head Start and Dr. Ruth Friedman from the Office of Child Care, who will each share some of the efforts they are leading to support the early childhood workforce. And finally, we are pleased to have Nicole Rose and Joan Altman from the state of Washington here with us to highlight their work and to improve health coverage rates for the early childhood workforce in Washington with ARP and other COVID relief funds. Thank you all for being here with us today and hearing the latest on this critical topic. And with that, I will turn it over to Beth, and would like to just express my thanks to Beth and the CMS team for the incredible partnership and focus on the early childhood workforce. Beth?
Thank you so much, Katie, and thank you so much to the entire ACF team for working with us on this week of action. And thank you to all of you for helping us get the word out that health coverage is more affordable and accessible than ever, thanks to the American Rescue Plan, and available through healthcare.gov or through state-based marketplaces across the country during this open enrollment period. As Katie mentioned, my name is Beth Ling. I'm the head of communications and external affairs at the Center for Medicare and Medicaid Services. I am excited to be talking to you about Marketplace Open Enrollment, also known as healthcare.gov, that is open right now for folks to take advantage of healthcare coverage. A few basics about the marketplace and about health coverage on healthcare.gov or through state-based marketplaces. So open enrollment runs right now through January 15th. The Biden-Harris administration extended the open enrollment period by 1 month, so folks have a little bit more time to take advantage of health coverage. But a pro tip, we're encouraging folks to sign up for coverage by December 15th so that your coverage starts January 1st. So for that year-round coverage, we're encouraging folks to sign up for coverage by December 15th. For folks that don't sign up by December 15th, they do have until January 15th, but that coverage will then start February 1st. So a couple of just key highlights. Who's eligible for coverage on the marketplace? Anyone who is legally living in the United States is eligible for health coverage on the marketplace. If you don't have insurance through your employer, you're otherwise uninsured, or if you're looking for a health plan at a lower cost, the marketplace is a great place to identify that coverage. And we know for many early childcare workers that may not get health insurance through their employer, this is a really great opportunity to get connected to coverage that is really affordable and really is high quality coverage. The plans on the marketplace provide health coverage that is comprehensive. It covers everything from preventative doctor visits, emergency care, diabetes care, access to any, mental health care services, behavioral health services, and more. So full range of services for folks that need it. I also want to note that the American Rescue Plan has made healthcare coverage more affordable than ever. So 4 in 5 consumers can find a plan for $10 or less per month. The actual plans and options that are available are you're able to find those and really search for those options on healthcare.gov by putting in your age, where you live, and your current income. And so folks are able to find a best plan that suits their needs. But I will say we're seeing more choices are available than ever, as well as lower costs. So really encouraging folks to take advantage of that. As Katie mentioned, we're excited to be partnering with ACF on this week of action next week to encourage early child care workers to take advantage of healthcare coverage on the marketplace. As a part of that, we want to make sure that everyone is aware of the enhanced help that's available in communities across the country. So on the slide that's up on screen are a number of resources that we want to make available to all of you and to folks across the country to help connect early child care workers to coverage. There's two resources that are specifically for this community that we've developed in partnership with ACF. They're in English and Spanish and talk about healthcare coverage, how it applies to early childhood education workers, and how folks can get connected to coverage, includes those kind of top line points that I mentioned at the top. It also provides resources, and on our website, we've got ways to connect to local help that's available in the community. So we have, the Biden-Harris administration has quadrupled the number of navigators that are available across the country. These are certified, this is certified help to help people get connected to healthcare coverage, to get their questions answered and things, and get anything that they need in order to get connected to that coverage. There's also certified assisters available across the country. And to find any of those folks, you can go to localhelp.healthcare.gov, put in your zip code, get connected to that coverage. These navigators also host events. And so if you have a community center or an early childhood education center, want to do kind of an in-service day, invite a navigator to come and get folks signed up. Depending on kind of the navigator in your area, odds are they'll be happy to kind of partner with you on some of those events and some of that outreach. We'll also have some social media messages to amplify next week that we'd love all of your help to engage around. So check out the links to download the social media toolkit as well as the talking points. And then for the outreach and the engagement doesn't stop next week after the week of action. It's going to continue through the entire open enrollment period that extends through January 15th. And so if you'd like to continue to engage with us around open enrollment, you can become a champion for coverage on healthcare.gov. We'll drop the application link in the chat. And by signing up to be a champion for coverage, you have access to printed materials that we will mail to you for free. You'll have access to weekly listserv emails, a weekly call during the open enrollment period, and other resources to help connect folks to coverage. So thank you so much, Katie and ACF team for having me here. And I think I'm going to turn the call to Dr. Bernadine Futrell, who's the director of the Office of Head Start.
Good afternoon. Thank you so much, Beth. Thank you, Katie. Thank you, everyone, for being here. Really appreciate where we are in this moment and appreciate that we get to do this work together. Good afternoon. I'm Dr. Futrell. I am the director of the Office of Head Start. I am a former assistant teacher in Head Start and a Head Start baby. And so I share that because I approach this work, I believe strongly in the theory of action, that in order for children to reach their outcomes, the adults in their lives have to be whole, happy and healthy and supported. Rita Pearson talks about her famous TED Talk, talks about the single most important factor in a child's life is that of a loving and caring adult. And I know for myself as director of OHS, I cannot imagine what my Head Start experience would have been like if my Head Start teacher, Mrs. Green, wasn't supported, didn't have the supports that she needs or the access to the information that she needs. So as we are moving forward, moving Head Start forward and getting back to in-person service is super important for us at the Office of Head Start to prioritize and focus on our Head Start workforce. It is the work of right now. It is a part of the work to move Head Start forward and the part of the work that we are committed to. And connected to that, the health and safety of our Head Start workforce includes providing support around mitigation and eliminating COVID-19 in our Head Start programs, and that's connected to our Head Start staff vaccine. You can advance the slide a few slides. Thank you so much. You can keep going. We're going to get to the vaccine questions. I see some questions in the chat. I'm going to try to address those as well. And so I do want to say thank you to the Head Start community for leading the way, because we know that on September 9th, President Biden released the Path Out of the Pandemic, which was the COVID-19 action plan. And under this action plan, it included the requirement of the administration for our Head Start workforce to be vaccinated. And we walked into that in September knowing that about 78% of our Head Start workforce were already vaccinated. And so we walked into that knowing that, and this support is really moving towards a fully vaccinated Head Start workforce by January 2022. So I want to just share a little bit about the current status of getting this information out to the Head Start community. First, the current status is that the Department of Health and Human Services has initiated a rulemaking process to implement this policy for our Head Start and our early Head Start programs. And so what that means is we cannot provide additional details specific to the content of the IFR before it's published, because that's the process that it's going through. But I do want to share that we do value the input we've received thus far from the Head Start community. It is so helpful to hear and know the ideas and areas that are most concerning as we roll out this vaccine requirement. As you prepare for this information, I do want you to know that OHS will issue additional guidance and information on the vaccine requirement as a goal to get that out as soon as possible, with the goal of being kind of December to have that information out. In addition to that, the IFR will also include some exemptions for religious and medical in alignment with others that have been there. And it's important to note that the goal is that this vaccine requirement is connected to the Head Start workforce to be implemented and started in January, and it's not related to the vaccine mandate that's for larger businesses. And so I saw that question in the chat. I wanted to address that as well. It is important to know that Head Start programs can use your ARP funds, your CARES Act funds, as well as the Coronavirus Response and Relief Supplemental Appropriation Funds, to support staff vaccination. And it's also an allowable use for your ongoing operational funding. Additionally, programs have flexibility to determine which one-time investments can really support the needs of staff, children, and families while adhering to the federal guidance. And so this includes using those funds for vaccine outreach and materials, for healthcare information sessions, for policy implementation plans and protocols, for transportation assistance to vaccine sites, as well as temporary coverage for those who may be absent from the workplace because of vaccine or recovering, offering paid time, sick leave, and other paid leave that really supports getting access to the vaccine, and really other needs to meet the vaccine requirement as determined by the local program. Once the IFR is published, OHS will host a series of webinars and engage in outreach to ensure that we are sharing information, but also providing us a space to support the implementation and the requirement of this. And we have created a series to really provide support for programs as they roll out vaccine requirements in their community. We're calling it the Strategies for Staff Vaccination, Voices from the Field, and I believe they're going to put it in the chat. And they're 3-minute videos that really highlights examples of programs who have been successful in implementing a vaccine requirement. And for example, Benton Franklin Head Start program, they were able to implement a vaccine requirement in a community where the vaccine rate was 23%. And so it's the leadership of Head Start that continues in communities and even through this vaccine requirement. But we do know and recognize that some members of our team, we want to be able to provide access to information and have conversations. So the goal of those webinars and those mini videos is to provide content to lead the way and have conversations. Next slide, please. And as we talk about as I opened up talking about Mrs. Green and the work of that, our Head Start workforce continues to lead the way and continues to do the work, not only to move Head Start forward, but really to move our nation forward. And I am grateful and thankful for each and every one of you. And we also recognize that the important work you're doing, the critical work to ensure the high quality comprehensive services during this time that we're in requires the heart to lead the way. And so what I do know is, despite the how much we value and understand the work, there are other things that we want to be able to make sure we're providing support and guidance on. And that's why OHS issued the IM supporting the wellness of all staff in the Head Start workforce. And really this gives guidance to take a look at the culture and the environment to ensure that it's supporting wellness for all staff, and something that's infused throughout the program services and interactions, because again, we want our workforce to have the support and to really understand what we can do there. And I want to just make the point that the ARP funds, again, can be used to support providing staff with incentives, paid leave, providing support. They can have regular breaks during the workday. All those things, I really want to encourage our programs to use the resources to really prioritize our workforce. There are many things that are summarized in this IM. I just want to point it to you, and I believe they're going to put the link in the chat that provides some examples of how other programs, as well as how the Office of Head Start is encouraging programs to use your base grant funding, as well as the ARP and other COVID relief funding to support the Head Start workforce and our staff. And with that, I am going to turn it over now to my colleague, Dr. Ruth Freeman from the Office of Child Care. Thank you.
Thank you so much. Good afternoon, everyone. I am going to talk a little bit about the progress that we are seeing in states. You all know, as well as anyone, how much childcare providers are essential to the well-being of families and the economy, and what a difficult year and a half it has been with this pandemic. We are seeing states and local communities take on promising strategies to address some of these challenges, and in particularly using their ARP and other COVID stimulus funds. And so I'm just going to briefly touch on some of those examples today and where we're seeing progress before turning it over to some guest expert speakers. So what you see on the screen in front of you is the very steady progress we are seeing states and territories continue to make in launching their ARP stabilization grants. Now, this was a brand new program that was passed into law this past March, and it was for states to send grants directly to child care providers in their state to try to help make them whole, be able to pay for staff costs, rent costs, goods and services, cleaning supplies, all sorts of flexible uses of funds to try to get the child care sector back on its feet. And we are at a point happily now where we have 20 states and territories who have released their ARP stabilization grant applications and have started issuing payments to providers. And an additional 18 states and territories who have released their stabilization grant applications and will be having their funds flowing soon. Those are all the states you see in green on the map in front of you. The remaining 18 states and territories in blue have not yet released their ARPA stabilization grant applications, but we are hopeful that they will be doing that in the months ahead. You can move to the next slide. Many of these states are using these stabilization grants to increase compensation for the workforce, both in terms of wages and benefits. So just to touch on a few examples, Minnesota has required 70% of these grants to go towards increased compensation, benefits, or premium pay. Nevada has required providers that employ staff to use 20% of their award for financial supports or benefits to staff. And Connecticut allowed providers to opt in to receive a 25% bonus funding in order to increase staff compensation, including contributing towards health insurance or staff retirement plans or coverage for childcare costs of the children of staff. So very important, innovative ways of trying to get this money flowing in a way that addresses the compensation and benefit needs of the childcare workforce. You can move to the next slide. Other states are using other ARP and COVID funds to address compensation and benefits in other sorts of ways. So for example, Colorado is helping providers recruit and retain ECE professionals through grants for benefits, compensation, professional development, or hiring. Oklahoma is providing childcare subsidy eligibility for employees of licensed childcare, regardless of family income. And Arizona has increased their infant toddler payment rates to the 75th percentile. All of this can end up having a real implication and benefit to our workforce. So as I mentioned, these states provide only a few examples of the great work being done, which is why I'm so pleased now to turn to Nicole Rose and Joan Altman, who are joining us today from the state of Washington. They have been out on the forefront on health insurance for the childcare workforce, and we wanted to give them an opportunity to highlight their innovative investment of ARP and CURSA funds. Nicole Rose is the Assistant Secretary of Early Learning, the Washington Department of Children, Youth, and Families. And Joan Altman is the Director of Government Affairs and Strategic Partnerships with the Washington Health Benefit Exchange. And with that, I am happy to turn it over to the two of you.
Great, thank you. And thank you for the opportunity to be here today. And just want to take a moment and thank you all for the great work that you continue to do to serve children and families during this time. And I think what I would start with saying is that we knew that healthcare and access to healthcare for childcare providers in Washington State was a need pre-pandemic, and the pandemic highlighted that even more. And as we think about really compensation and making sure that providers have what they need to serve children and families, we really think about healthcare as part of that compensation package. We do have a licensed family child care union here in Washington State, and those providers did have access to healthcare prior to the pandemic. But we had a real opportunity during this time to come together and think about how do we increase access to healthcare across all of our early learning settings that are licensed, and really look beyond just our assistants and lead teachers and think about who are the staff in that entire center or licensed family home that need access to care. One of the things that I would also note is that it's no small feat to make something like this happen in a state. We didn't do this alone. We had lots of advocates who really spoke up and said that this was a need and talked with the governor's office, legislators, and others to really help us think about how we might be able to implement something like this. We had also had a pilot in place that allowed us to test some things out quickly, and Joan's going to talk a little bit more about this, where we'd already had some success of connecting two state agencies before money was even on the table to come together and think about what is the assistance that providers need to really navigate the exchange and access healthcare. And so we're able to really build upon that. So I think it's really important as you think about sort of how you make something like this happen, that you're really thinking about what are the natural partnerships that are already there. We also have an authorizing environment in Washington State, meaning our governor's office and legislators and others who have had a real eye on this, including our Child Care Collaborative Task Force, which is really looking at how do we make sure all families have access to care and that teachers are compensated properly. And so this really was something that was really being looked at. And so again, we were able to come together, do some work behind the scenes in legislative session and end up with quite a bit of dollars on the table to support providers in accessing healthcare, really at no cost to them right now. So I'm going to turn it over to Joan to talk about really how this is working in our state.
Hi, good afternoon, everyone, and thanks, Nicole. And it's humbling to be part of this group, and thank you, everyone, for the work you are doing and have been doing during the pandemic. My name is Joan. I work at the Washington Health Benefit Exchange, which is the group in Washington that runs our version of healthcare.gov. It's healthplanfinder.org. So we run the Washington state-based marketplace, and in partnership with DCYF and some local community partners, have sort of tried to quickly stand up and implement a program that provides employees of licensed childcare facilities in Washington access to a high quality health plan through the exchange, where they can benefit from the federal subsidies and also benefit from a state subsidy that brings their premium down to $0 a month. So we stood that up. The bill passed in May, and then we set up the program in September. So we just launched it, and now we're moving toward enhanced outreach throughout November to take advantage of the open enrollment period that was mentioned earlier, that both at the state and national level runs from November 1st to January 15th, providing everyone an opportunity to come in and get some really low cost health coverage. So if you are someone who needs health coverage, if you are working with or for people who need health coverage, I highly encourage you to come check out the options both in Washington and nationally. How the program works is that the legislature appropriated $30 million, $25 million in CRISA funding and $5 million in ARPA funding that pay for these wraparound premiums. So the worker or the employee still has to pay for their cost sharing when they go seek a service, but otherwise their monthly bill is zero. So how it works is that DCYF, Nicole, and her team send out an initial outreach message to all the qualified workers, which in Washington, and employees. I should note that it's beyond just childcare providers. It's anyone who works at a licensed childcare facility in Washington. I've learned a lot about home-based and nature-based and other bases that you all cover, and it's quite impressive, but it's a very broad definition. If you are recognized by DCYF as being an employee in a licensed childcare facility, you are in. Folks are receiving initial outreach from DCYF and then follow-up outreach from our community partners to offer enrollment assistance in helping them navigate our online application. Someone signs up through healthplanfinder.org, and then the exchange makes payments to the insurance carriers on their behalf. So the program right now is funded through 2022. There will likely be some continued advocacy to continue the program and/or potentially expand the program into future years, given the availability of some additional federal funding. So people who are eligible, really family center-based, outdoor nature-based, anyone who has a household income below 300% of the federal poverty level, which is sort of up to 40,000-ish for one person and up to 80,000-ish for a family of four. You come through, you enroll, you take the federal subsidies available to you, and we cover the rest. So again, it's how it's going. We've done some initial outreach to that 33,000 plus. We've had several thousand reach out and get connected to coverage. And I will note, if you are in a state that doesn't have a state-based marketplace or doesn't have a $30 million lying around yet, or doesn't even necessarily have a local strong a navigator organization, but you may have a local partner that you work with to provide enrollment assistance, or you may have federal navigators that you can partner with. There are ways to replicate this, and we've been working with states across the country to try to replicate this model, even if you don't necessarily have all of these pieces. So as Nicole mentioned, we did a pilot before we launched the full program where we had no additional funding, and just because of all the barriers that folks face applying for health insurance, just connecting people with the enrollment assistance that was mentioned earlier that's available wherever you are in the country, helping people navigate the enrollment application, helping provide language assistance, that resulted in hundreds of people getting connected to Medicaid coverage that was free and already available to them, even without the additional program funding to cover healthcare costs for people who are just over that Medicaid threshold. So again, lots of really interesting and continued dialogue with partners and legislators and state agencies around how to improve and sort of expand on this idea. We're always happy to talk to other states and folks who are interested. Happy to answer questions, curious to hear what questions people may have. Drop some information in the chat for those who are interested in taking a little bit of a deeper look, or if you yourself are a childcare provider, an employee of a licensed facility in Washington, please, use the link, call us, reach out. We're here to help you get connected to the sort of broader theme of today's panel. I think, in looking at other social determinants of health, health coverage is one really important piece, but income stability, wages, your economic stability, the sort of broader base of things that can influence your health and are a key determinant of health are what you all are working on through so many other different initiatives that are so important. And we know, 50% of people in our country have medical debt, and even our customers who have coverage note concerns about using their coverage because they may get a bill or they may have to provide some money out of pocket. So really looking at these things as a constellation of solutions that can all work together is something we're committed to and interested in, and learning from all of you all has been a key part of how we're going to move this forward. So I'll pause there and welcome questions I'll direct all your childcare questions to Nicole and direct all your healthcare questions to the Surgeon General. No, I direct them, we'll do our best.
Thank you so much, Joan and Nicole. We have a lot of questions. Several people have asked about a recording that will be made available via email. So I think a lot of folks have questions specifically around the enrollment and the availability of health insurance through the marketplace. We will make sure that we provide additional information about how to engage in that. Our week of action is next week, and we'll be sure to share more resources. It sounds like there's a lot of interest in that. And as Dr. Futrell said, there's also a lot of questions coming in about Head Start vaccine requirements, and the Office of Head Start will continue to provide information on that in the coming weeks. I want to thank everyone for being here with us today, for taking time out of your day to connect with us. In the chat, we're going to provide some more information about public service loan forgiveness. The Department of Education recently announced actions to restore public service loan forgiveness, including a time-limited waiver so that student borrowers can count payments from all federal loan programs or repayment. We will be delving into this a bit more in our December ECD Live. So stay tuned for more information and check out that link that's in the chat. Thank you for your participation today, and remember, be a champion for coverage, and let's get our early childhood workers covered with health insurance. Thank you so much. Have a great afternoon.